Endometrial receptivity test in IVF programs. Embryo implantation is a very complex process that takes place at a specific moment during the endometrial cycle. Not every woman has the same receptivity window, and that's important to know to have the maximum chances to succeed in an IVF cycle. When we have IVF failures, we have to know what the possible causes may be. We know that the embryo is the main cause for IVF failures, since its quality will determine the chances for pregnancy in each cycle. But we don't have to forget that the endometrium is also a very important part of the cycle. We have to know that the endometrium is ready to receive the embryo at a very specific moment. When we undergo an IVF cycle and we don't succeed, even though we have very good quality embryos, or we have different miscarriages, early miscarriages, or biochemical pregnancies, it is important to do some other investigations on the endometrium to try to assess what the causes may be. Endometrial receptivity tests try to tell us whether there's a problem in the implantation window and we need to do the embryo transfer in a different moment. Some patients are more receptive before or after the moment we think they are, and so we need to adapt our treatment protocols. To do the endometrial receptivity test, we need to mark a normal cycle. We need to mark the cycle where we will transfer the embryos. So if we're going to do a natural cycle, we should do the same for the endometrial test. And if we're going to do a substituted cycle, we should do the same for the endometrial test. That is, we prepare our patient to go for an embryo transfer, and the moment where we should do the embryo transfer, we take an endometrial biopsy and we analyze the genetic pattern of this endometrium. This test will tell us whether we need to do the embryo transfer at a specific moment, and we will know the exact timing for the embryo transfer once we are preparing our patient for the right moment.